Some of our previous work with Dr. Brigman and Dr. Ewart and our team at Duke has been around margin assessment. So the issue when you take a tumor out is that we rely heavily on margins because that's been shown to relate to the incidence of the tumor coming back, so local recurrence, and also overall survival, so patients surviving their disease. And so what we mean is when you take out the tumor, you hope to leave no tumor cells behind. And in order to achieve that, we look for a negative margin. And so the only way to assess that, though, is after surgery. So you take the tumor out, and then the pathologist looks at it, and then 2 weeks later, maybe they're able to say, yep, you did get a negative margin, or nope, looks like you might have gotten a little bit close in this sector, but then it's already 2 weeks after surgery, and it may be too late. And so what's needed is a means of intraoperative margin detection, or being able to tell if you're leaving any tumor cells behind, because sarcoma is notorious where if it contaminates the field, it will seed and spread, and a very high incidence of local recurrence or coming back. And so with some of the work out of our team there at Duke, we've developed a means of assessing margins intraoperatively, and we do this with it's a specific activatable fluorescent probe. And so there are certain things called cathepsin proteases which are overexpressed in sarcomas. Once we introduce this fluorescent probe, it gets activated in the presence of these certain proteases, makes the tumor fluorescent, and then once we pull the tumor out, we're able to identify, are there any cells left behind? And so we've done a lot of work with that, and specifically actually developed a laser ablation system which we've tested in mice where you can actually target those cells, zap them, kill them, and then affect patients' outcomes. So actually affect the recurrence of the disease and their overall survival. So that's been an interesting thing that we've been working on. It's been a long road, but we're pushing it forward.